Imagine if you had your own personal nurse living in your home who knew your medical history, who knew what chronic diseases you had, who knew what was going on in your life in terms of your medical care. Imagine what that would be like if you had this person living in your home 24/7, available to you at any time that you wanted. And not only for you, but for your spouse, for your partner, for your kids, for anybody that's living in your home. That person knew what was going on. Now imagine if it wasn't only a nurse, you also had a dietitian who was living in your home. Somebody who knew what you were or were not eating. Maybe you don't want that, I don't know. That's up to you to decide. But this person could give you advice about what to eat, what not to eat, track what you're eating, track your calories. What if you also had your own pharmacist? Somebody who knew what was going on with your medications. Maybe it could give you advice if you had a question about supplements or other medications, other interactions. Can you take what you want to take? What about a physiotherapist? Let's throw a physiotherapist in the mix, or an exercise professional, somebody who could guide you through your rehab. And I know there may be 1 or 2 people in here that has plantar fasciitis or Achilles tendonitis, and they might want their physiotherapist right there to coach them through their rehab. Let's throw in a therapist. You've got your own therapist. You're getting quite the healthcare team there in your home now. It's starting to get a little crowded. And let's throw in a physician so she can start to give you some advice about what's going on in your symptoms. Let's throw in a social worker so this person can help you navigate the healthcare resources in your particular community. And let's throw in your own medical office assistant, somebody who can book your book your appointments for you, check when you're free, check when you've got some time to see your doctor, your live doctor. So it's getting pretty crowded, and I don't know about you, but these people in my house would be eating a lot of food, and I'm not sure how practical that is. But what if we could take this whole healthcare team, and remember, one for you, one for each person in your home, and let's shrink them all down and put them in something like that. So my name is Teri Fisher. I'm a physician. I'm a family physician and a sports and exercise physician in Vancouver, Canada. I'm a clinical assistant professor at University of British Columbia. And I love technology. And I've always loved technology. I'm an early adopter. And in the next 20 minutes or so, I want to tell you why. We've heard lots of great speakers this morning commenting on all different aspects of healthcare and voice. But I want to tell you why I think this is going to revolutionize healthcare. And we had a great question from somebody earlier this morning, and the comment was that this is one of the most exciting things that she has seen in about 30 years. And I want to tell you why this is going to completely revolutionize healthcare, but also what are the implications for the healthcare system. This is going to be more of a higher level talk and tell you what I see coming up and why, more importantly. So how many Canadians are in the room? I know there's a couple. Or 2. All right. So this is great. So apart from you two, I could say whatever I want here and nobody would know the difference. So that's perfect. But I'm going to start with a little story. Okay? So this is about 20 years ago now, if I date myself a little bit. And I came home one day, and on the table there was an envelope, and the return address said University of British Columbia Faculty of Medicine. Pretty cool. I opened that up. I was pretty excited, pulled it out. Congratulations, Mr. Fisher. You have been accepted into the University of British Columbia Faculty of Medicine. Fantastic. I was excited. I was ecstatic. I went around, told my family, told my friends. Everybody was really happy for me. And then, of course, we got into some more of the discussions about healthcare and the issues with healthcare. And if you're familiar with the Canadian healthcare system, it's great. I'm very proud of it, but there are definitely issues in terms of accessing care and wait times and all that sort of stuff. And so, but around that time, like, the internet was coming of age. And it was like, hey, great, there's this new thing, the internet, we're going to be able to revolutionize healthcare. And you know what? People threw more money at the system. But things are largely the same as far as access goes in healthcare. And let me give you a little bit of stats. Again, these are from a Canadian perspective. But there was the Commonwealth Fund International Health Policy Survey of Adults. I wanted to get that right. In 11 different developing countries. And they surveyed adults, 18 and over, about their experiences, their perceptions of their health care. And what they found was that Canadians reported the longest wait times out of any of these countries. Okay? And in particular, some specific stats. Family doctor wait times. 1 out of every 5 Canadians reported waiting at least a week to see their family doctor. Now, I can tell you from a personal perspective, my mother, she's elderly, and recently, over the last couple of months, she's been suffering from pretty severe back pain. So she called up her family doctor and said, look, I need to come in. I've got back pain. And he said, okay, well, let's see. Let me check my schedule. Or his MOA said this. And she says, we can get you in about 6 weeks. But you know what? If you're able to come and see me at 9:30 at night, I can probably get you in about a week to 10 days. So my mother, elderly, with severe back pain, with mobility issues now because of the back pain, is supposed to get to her doctor at 9:30 at night. Emergency room wait times. So the stats here say that about 1 out of 3 Canadians reported waiting 4 or more hours. Again, personal experience. I was seeing a patient just a couple weeks ago. He was seeing me in follow-up after being in the emergency department because he had rolled his ankle. And understandably, he was concerned that he may have fractured it. So he went to the emergency department to get an x-ray. He ended up waiting 6 to 7 hours overnight to get an x-ray of his ankle. And finally, specialist wait time. 1 out of 2 Canadians have reported waiting at least a month to see their specialists. And again, personal experience. A couple of weeks ago, I was in seeing my ophthalmologist for routine eye check. No problem. He says everything's great, looking good. I think we should just have a regular routine follow-up again in about 2 years' time. Great. I'm ready to go. He says, but you need to book that today. I said, well, I don't know what I'm doing 2 years from now. Like I'll book it closer to time. He said, well, if you wait 2 years to book it, you'll actually see me in 4 years because right now my waiting list is 2 years. So just book it today on your way out. So I have my scheduled ophthalmology appointment in 2020. So it's not all doom and gloom, though. Quality of care, really interestingly, is that 74% of Canadians say they get excellent or very good care, which is actually higher than the 11-country average of about 65%. So what does that mean? It means that the problem is not necessarily the quality of care, but it's the access to the care. And this comes to the point where I believe that voice technology and what we're all talking about has the ability to completely revolutionize everything. Because we're going to be able to take this voice technology and through what I'm going to explain to you in the next maybe 10, 15 minutes, how that is going to help us with access and how it's going to help the healthcare system as a whole. So the solution, in order to have a good, functioning healthcare system, we need 3 main components, and there's been some discussion about this in various papers in the media, so I'm not coming up with these ideas. But in the context of voice, I think this is very interesting. So the first one is the right care, obviously. If you don't have the right care, nothing else matters. You have to be getting the appropriate care. Makes sense. That one's pretty self-explanatory. The right time. So this is key, based on what I just described to you, this is key. We have to make sure that people are getting access to the medical care when they need it. And it's got to be at the right place. I'll give you an example here. Canadians will often go to the emergency department for something like a cold because they can't get in to see their family doctor, which makes no sense at all because the cost, obviously, of the cost of an emergency room visit is much higher than the cost of an office visit. That's just one example. So I want to briefly touch on each one of these. But ultimately, this is sort of the point of this talk, is that I think that VoiceFirst ambient computing with those microphones all around us that we've been hearing about are going to be the operating system of healthcare. Bottom line. So let's talk about the right care. The problem with providing the right care is you have to first define, like, what is the right care? And for the lay person that's at home and they're trying to get the right care, how do they know what the right care is if they don't have that experience of knowing what the right care is, right? It's what comes first. Because the right care, it could be, yeah, you need to see your doctor. but it also might be that you need to just take a couple of ibuprofen. You've got a headache, you've had a headache for a couple hours, had a long day at work, staring at a screen a lot, tension headache. Maybe that's the right care. Maybe it's you need to do your exercises. Maybe you need to get a massage. Maybe you've got a sore, you woke up funny and your neck is sore and your muscle's really tight. Or maybe the best care for you is really to climb into bed. And in that case, maybe if you go to access the medical system, you're actually just putting more pressure or more burden on the healthcare system, which is not needed in your particular situation. So this is something that the province of British Columbia, where I live, that they have done. They have a service called HealthLink BC. And what they do is they have live operators. They call them health service navigators. It's a free phone line that BC residents can call. 811 is actually the number, very close to 911. I don't know about that, but anyway, they chose 811. And when you call this operator, they can then put you directly in touch with a live nurse, a live dietitian, a live exercise professional, or a live pharmacist. And that's great. It's a great resource, except that, of course, this costs the government money to staff this 24/7. And in some cases, some people actually have a little bit of apprehension about calling a system like this because they don't want to feel like it's a burden on the system. I don't know if I really need to call these symptoms. I don't know, that kind of thing. So what if we could take this and create a voice navigator? And I know there are some companies that are working on this, which is fantastic. But basically, we have the same kind of thing, but as a personal health voice navigator, where call them whatever you want, an e-nurse, an e-dietitian, an e-exercise professional, and an e-pharmacist. And instead of having to call, you simply talk to your smart voice assistant in your home, and you start to get some advice. So I believe that VoiceFirst ambient computing will become, not totally the care provider, of course. We can't replace physicians for certain things, but we can replace healthcare professionals for specific things as well. And I think that is something that is going to happen. Let's talk about the right time. So as I mentioned, this is a big, big issue with the Canadian healthcare system in particular. So what is the right time? All right, so here we are. It's August 7th. We're at the conference, and you've got a health question on your mind. So maybe when you go home and you talk to your health navigator or your healthcare assistant or whatever we want to call it, you explain what your problem is, and maybe your question is, you know what? Can't remember when I'm due for my next screening colonoscopy or mammogram or pap test or whatever the case is. And it knows you, and it knows your health records, and it knows your risk factors. And it says to you, you know what? Don't worry about it. You're not due for another 8 months. I'll remind you in 8 months. Perfect. Or maybe you go home and you say, you know what? I had a sore knee, and it's been bugging me for a couple of weeks. It's not terribly sore, but it's nagging. And it says to you, you know what? Let's make a note of that in 2 weeks. I think this should be dealt with in 2 weeks. Great. Or maybe you say, you know what? I've been feeling tired. I just haven't been feeling right the last couple of days. I kind of had a fever on and off, maybe not the fever. But the point is that it's a little bit more acute in terms of what your symptoms. And it says, you know what? If it doesn't settle down, let's get you to see your doctor in a week. Maybe there's something that's a little bit more pressing, and it says you need to make an appointment today. Or maybe it just calls an ambulance for you. I've got chest pain, feeling shortness of breath, sweating, the whole bit. So with this sort of function, this voice assistant is essentially acting as a triage nurse, right? So it can help you to determine the urgency of the medical problem. It can help to direct the resources in a much more efficient way, because now the person that isn't sure if they should be going to the emergency department or the family doctor is given some advice in terms of what to do. And what's really neat about this is that this is actually helping the population, the resources of the population, but at an individual level in the home. So, what about in the office? And we've had some discussion about this as well. What if, as Nate was just speaking about, what if we had an assistant in the office, and when it came time to book an appointment with a specialist, it could tap into databases, and it knew who had the shortest wait time for the particular problem. It could then perhaps even schedule that in real time, and of course communicate that so that your smart AI device at home knows what's going on as well, and everybody's in the loop. So, this type of device can be a triage nurse. And what about the right place? Well, where is the right place? It kind of goes back to that question about what is the right care, right? How does one know where the right place is? Because the right place, again, could be a hospital. It might be a doctor's office. Maybe it's a question that you have about traveling or your kids' vaccinations. Do you actually need to go to a hospital or to a doctor's office? You could go to a travel clinic, and if you have specific advice from your smart AI assistant, it might be able to direct you in a little bit more efficient way. Maybe the appropriate place is in a senior care facility, or maybe it's, again, staying at home. So in such a way, these devices become a healthcare guide, almost like a tour guide. You know, for this issue, you want to go here. For this issue, you want to go here. And, you know, let's send you to this place in a week. Let's send you to this place in a day. Let's send you to this place in 3 months. But just imagine what that does for the pressures on the system external to the home. So these are some other healthcare applications. We've heard lots of great ideas already this morning. Some of these will be similar. But just sort of brainstorming and seeing where this technology is going to take us. We could probably come up with hundreds of ideas here if we went around the room. But essentially, so first aid, we heard about that, right? First aid applications are being built. Physio rehab, we've mentioned that a little bit. It'd be great to be able to talk somebody through their rehab and log what they're doing so the physiotherapist knows what's happening. How about speech pathology exercises? Talk about voice, huh? Listening to the voice, encouraging the person to make changes or practice certain exercises. Prenatal care. How many questions are typical of a woman who's pregnant for the first time? Right? It's very exciting. There's also some anxiety involved with that. You know, what's normal? What's abnormal? What do I do? What do I eat? What do I check? This could be a fantastic skill. Pharmacists, we've talked a lot about that. There's lots of applications for pharmacy and supplements. How about a cessation program where the device has been programmed with motivational interview techniques so it can talk to you and it can help you to determine what is your next course of action based on where you are in your current state of change of that habit. Mental health counseling, we talked about that. Post-op care, we heard another example of that. So guiding you through your post-op care, nutrition counseling, and chronic disease management. And of course, we can go through just about any area of medicine and come up with ideas. So, everybody here, or who is familiar with patient-centered healthcare, that concept? Great. So patient-centered healthcare, it's a great concept. The idea is that the patient is at the center, and everybody's working their best to help to control, or not to control, do their best to help help the patient, essentially. Everybody's working towards the common goal with the patient in the center. But I've got a slightly different perspective that I want to present to you. This is what I think of patient-centered healthcare. There's the patient. And this is the healthcare system. And the patient is somehow trying to navigate this system, which has got all these different silos, all these different stakeholders, and everybody's trying their best for the patient, but the patient is lost. The patient doesn't know where to go or what to do. So I think as we move forward in this voice-first world, I think we need to move forward and come up and start using this term, patient-first healthcare, where this is the patient. The patient is controlling their own healthcare at home through these smart AI devices and then getting the support of the healthcare team when they need it to help guide them in their interaction with the healthcare system. And it's only now through the through the power of the computing and AI that we're actually able to even consider this. So this is very exciting because obviously we're here, we all agree VoiceFirst is the future, but it's a way that we're going to be able to really bring health into the home. And when we bring health into the home, then we can start to have this personalized healthcare, eases the pressures off of the system, and ultimately, I believe everybody wins from this. So, with that being said, we'll take some questions at the end. I have a special announcement that I wanted to make as well. And we're all here because we all believe in healthcare and the voice of healthcare. And through Bradley's excellent podcast and Matt Sabolsky, where's Matt? Is Matt here? Maybe stepped out. And Matt Sabolsky, if you're not subscribing to the Voice of Healthcare podcast, you've got to do that because they are pioneers in this and they are doing an absolutely remarkable job with their podcast. So shout out to those two. At the same time, there's so much happening in VoiceFirst and healthcare that with the support of VoiceFirst FM, I'm launching a podcast. It's going to be a weekly podcast with interviews, news, research covering healthcare and voice tech, VoiceFirst Tech. So it's part of the VoiceFirst.fm network, which I'm very, very proud to be part of that. So it'll join the Alexa Canada podcast that I do as well. And this is called VoiceFirst Health. And 3 episodes are out today. The first one is sort of an introduction to the podcast. The second one is an interview with Rowena, our keynote speaker from this morning. And the third episode is with Ilana, who is our keynote speaker from this afternoon. And those are all live right now. So it gives me great pleasure to introduce that. Thank you to everybody that has contributed so far. And I really see this as a forum for all of us to work together. Quite frankly, I'm sick and tired of all these silos in medicine where nothing gets done and everything happens so slowly. And I see this as a way for us to communicate with each other, to learn, to work together, because I think the future for VoiceFirst and medicine is incredible. But the only way we're really going to make some changes is if we work together. So with that, I know we're coming up to lunch, so oops, put that last slide back up. Thank you very much, and I don't know, Bradley, if we have time for 1 or 2 questions. Or I'll be around the rest of the day. Yeah. That's good. That's good. Perfect.